Okay, I'm talking about cording, which is also known as axillary web syndrome. It was first described in the research in 2001. It's not entirely understood what it is. The most likely explanation is clotting in the lymphatic system. This is not a dangerous clot like a blood clot, but this clotting occurs due to damage during the surgery because the surgeon cannot see all your lymphatic vessels. You can get it even when no lymph nodes are removed. So, for example, if you have a double mastectomy, you've taken the healthy breast for prevention, no lymph nodes taken on that side, you still can get cording on that side. And you can get it in the arm, your underarm, or your trunk, so under the breast. So you can get one cord or multiple cords in this picture here. You can see the 3 cords in her underarm, and here you can see the one long cord running down her arm. So signs and symptoms, you can get a cord or cords appearance, but it's not always visible. It might become apparent when you're reaching for things, and then it becomes uncomfortable and it interferes with your range of motion. One person described it, it was like pulling a guitar string down their arm. You can get a cellulite type appearance, even in very slender people, and that's just the adherence of fatty tissue to the cording. It can be more obvious with skin traction. So if you feel that tightness in your arm, but you can't see it, and you just kind of stretch that skin, then you might be able to see the cord. It also might feel like bubble wrap. So you run your fingers over it and you feel that bump. How prevalent is it, or how many people get it? Again, it's mixed in the research, anywhere from 20 to 40%. Most will occur within a month of surgery. Some people it can occur earlier, and other people can have a later onset. And this later onset can be triggered by anything causing inflammation. So a sudden spike in activity, or you have chemo or radiation. And people can have recurrences. There can be spontaneous resolution, but one particular study showed half of people still had it 18 months after their surgery. What are the risk factors? Well, you're more likely to get it with a double mastectomy because of more inflammation, more trauma. People with a leaner build, it's unknown why. Damage to a nerve, you'd feel numbness at the back of your arm or over your triceps area. Again, not really known why. So why do we care? Well, apart from it being uncomfortable and it's not great to not have your full range of motion, you need to restore your range of motion before you have radiation. And this person is demonstrating the position that you are in radiation. Also, just that normal use of your arm and having your full range of motion will reduce your risk of getting lymphedema. So I just want to briefly mention serious signs and symptoms. So when would you need urgent medical help? So these are things that are not cording. So if you felt a sudden onset of swelling, there was pain, warmth, or redness anywhere, breast all the way down to your fingers, this could be a sign and symptom of something serious. So cellulitis, this is the picture here. So that redness there, that needs urgent antibiotics, or you can get blood clots in your arm. Not very common, but be aware that it is possible. Okay, so cording, the good news is it usually responds well to treatment. So this video is just to equip you with some tips in the meantime, but it's best to go see a physiotherapist or a physical therapist. So treatment in a clinic might start with a warm-up, like an arm cycle or a cross trainer, soft tissue massage, followed by some stretching. Have twice a week with your therapist until it resolves. You wouldn't start this hands-on massage treatment until at least 3 weeks after surgery. Definitely wouldn't do it if there were drains in place. You wouldn't be massaging over radiated areas during radiation and for up to 8 weeks afterwards. And I've just written a note down here. It's really important that if you have been struggling and you do your stretches and you manage to get your movement back, that's fantastic. Then try to use that arm normally, reaching up for a cup out of a high cupboard. Because with any injury that we have, our brain will quickly forget how to use a limb. So try to use that arm as normally as possible. Okay, just draw your attention that you can get a pop. So, you can be stretching, feel a pop sensation, and this is usually followed by instant pain relief, and you've got all your movement back. It's not really known what this is. Is it the cord breaking? Is it the tissues, the surrounding tissues breaking off the cord? The main thing is don't panic if you hear a pop, but any self-massage or stretching, you want to be conservative. You don't want to be like going in really hard because you will increase inflammation and you can make the cording actually worse. Stay tuned for the next videos where we're going to go through some self-massage techniques and some range of motion exercises and stretches. This is not letting me stop the recording.